Hi, my name's Melanie Burnett, and I'm the Director of Pharmacy here at the Medical Center. I'm here today to tell you about pharmacy services and how we promote the safe use of medications across the organization. The pharmacy services a broad range of hospitals and clinics across the region. We have 3 infusion sites, as well as a community pharmacy that services our St. Bernard's employees. We also have an acute care pharmacy here in the main hospital. The central pharmacy, staffed 24 hours a day, is located on the ground floor across the hall from the gift shop. This is where medications are received, stored, verified, and dispensed for the medical center and for our off-site behavioral health services. The pharmacy manages supply of nearly 1,800 formulary medications. Due to supply fluctuations and varying demands, we meet twice weekly to make sure that we've got all stock on hand so we are able to take care of our patients. We place drug orders 6 days per week and receive drug orders 6 days per week. There are 5,400 doses dispensed on average each day at the medical center. That's nearly 2 million doses per year. Each dose has to be checked and verified by a pharmacist before it reaches the bedside. So we use a lot of various technologies to help us make sure this is a safe and efficient process. This is our medication carousel. Once a medication order is verified by a pharmacist, a message is sent to the carousel and populates into a picking queue. Pharmacy technicians process the orders using barcode technology to verify that we have the right drug for the right patient. We also have 75 omnicells across the health system that assist in medication dispensing at the nursing unit level. When a medication reaches a reorder point, a message is sent to the pharmacy that triggers on a restock so that we will refill those medications before they're out of stock. This is our tray safe console. This is how we manage and process all of our crash cart trays. Used and open trays are returned to the pharmacy after a code. Staff members will restock the needed medications and insert the tray into the console for processing. This device takes a picture of the contents of the tray, reading unique barcodes placed on each medication. The camera captures the lot number, expiration dates, and evaluates the appropriate quantities and placement of every item. It will alert staff members if any of those elements need to be addressed. The main pharmacy also houses our sterile compounding services. This is where our pharmacists and technicians make all of our sterile compounds for the medical center. They compound about 250 compounds each day in our IV room. We use a lot of technology to make sure that we're safe in this environment, and so we use a lot of barcode scanning as well as remote verification to be sure we've got the right components in each IV. Pharmacy services also include sterile compounding sites in our infusion areas, both in Jonesboro and in Paragould. These sites prepare both hazardous and non-hazardous medications for our outpatient infusions, and together they verify, compound, and dispense about 165 compounds per day. The medication history team is a core group of people that work to obtain those home med lists for our patients that are admitted to the medical center. Our team consists of pharmacy technicians as well as a few LPNs, and they work really hard to make sure that we have accurate home medication lists as patients enter the hospital. They do about 90% of the medication histories here at the medical center, and they are staffed 24/7. The employee pharmacy fills about 220 prescriptions per day for our employees. This is a great service we're able to offer to our employees because we're able to offer these medications at cost. Also, the employee pharmacy does make deliveries to the medical center as well as some various outlying clinics, so it's easy to get those medications when you need them. They also offer delivery to the main pharmacy, so we have 24/7 pickup to help service our employees.
My name is Andrea Davis, and I'm the Clinical Pharmacy Manager here at the Medical Center. I'm also the Residency Program Director of our Postgraduate Year 1 Pharmacy Residency Program. Our clinical pharmacy team is on site 7 days per week from about 7 a.m. to 19:30 every day. They are stationed throughout the medical center. You'll find pharmacists in the emergency department, in our ICU, on our NICU and pediatric floors, in other med-surg floors, in our oncology clinic, and you'll also find them at St. Bernard's Behavioral Health. We also have a clinical pharmacist that rounds with our internal medicine residency program Monday through Friday. Our clinical pharmacists are helping with a variety of tasks, such as vancomycin and aminoglycoside dosing, renal dosing, anticoag monitoring, antimicrobial stewardship, and TPN dosing and monitoring. Our pharmacists are also available to you guys when you have questions regarding maybe patient care or medications. Pharmacists are also helping with a variety of committees. We lead the Pharmacy and Therapeutics Committee, which helps with formulary management and medication use processes. Our pharmacists are also helping along the way with evidence-based medicine and ensuring our order sets are revised and up to date. One of our clinical pharmacists, Dr. Marcia Crater, is involved in the antimicrobial stewardship efforts within the medical center. She works closely with the infectious disease team and also the microbiology lab to ensure our patients are taken care of. Another pharmacist, Dr. Jeremy Hanner, is our medication safety officer in the medical center. You may find him on the medical floors talking to nurses about medication safety concerns. Our pharmacists are also involved in teaching the next generation of pharmacists. They are teaching our PGY1 pharmacy residents, and these residents are involved in a variety of rotations. You're going to see them in the emergency department, you may see them in the ICU, and also on the medical floors. These residents also gain training in leadership, teaching, and research. Besides residents, we are also teaching pharmacy students from colleges of pharmacy in Arkansas and Tennessee.
We hope you enjoyed hearing a little bit about the pharmacy today. If you ever have any questions, reach out and ask. We're happy to help.